Last year I was fortunate enough to get funded what is called a starting grant from the European Research Council. The main topic of this project is to understand how the urban environment relates to cardiovascular health. Very importantly, this project will last 5 years and we have a whole budget of 1.5 million euros. So that gives us the opportunity to develop very much our research group. Very specifically, what we are doing in our project is to study how 4 domains of the urban environment relate to cardiovascular health. Mainly what we call the food environment, tobacco environment, alcohol environment, and physical activity environment. One of the main parts of the project is to use qualitative research in order to understand how the residents perceive and understand their environment in terms of how do they behave.
My role into the project is to study how the urban environment relates to physical activity behavior. To do so, we study how the streets and how the bike lanes relates to the physical activity behavior that we do each day of our lives. Also, we study how the public spaces and parks like this beautiful park relates to physical activity in order to know if this is important to cardiovascular health.
My work is to study the food environment in Madrid. That is, the places and the food services where people can buy or acquire food. This is very important because it directly influences the diet and the prevalence of obesity and overweight. In the pilot study, we have seen that the most available places in Madrid are supermarkets and lifetime stores. These are the ones that offer more healthy food options for people and the ones that we should promote.
My task within the HHH project is to make cartography and spatial analysis to characterize the urban environment in terms of diet and physical activity. With the information regarding our field team and with the other secondary database, we want to calculate our synthetic index to know how healthy is the environment for the residents.
The social impact of our research results may be very large, actually. It is based on the translation of our publication results into public policies that help developing the best way to prevent non-communicable chronic diseases or cardiovascular disease. One of the main characteristics of our research group is the interdisciplinarity of the members. We include biologists, sociologists, geographers, epidemiologists, specialists in primary health care, in preventive medicine, etc. And that makes the group absolutely very interesting and fascinating. Finally, also our group is characterized by our international purpose and our international collaborations. We work very closely with universities in the United States, in England, in France, etc. And I think that it's absolutely positive for our group.